Hello, everyone, and thank you all for joining me today. My name is Rain Yuri, but I go by Rainy like a rainy day, and I am a realtor in the Tampa Bay area. Today, I have a special guest with me, Miss Janine Henson, and she's going to talk about her organization, which I have did some research on, and trust me, you guys definitely want to stay tuned and listen to how powerful this organization is and how helpful it has been in our community. So, Ms. Janine, first off, thank you for joining me today. I'm so glad we have this opportunity to talk more about your organization.
Thank you for having me, Rainey.
Okay, so I have a couple of questions here that I just want to ask, and we'll go from there. So, my first one is, can you tell us about your background, your experience, any hobbies that you have, as well as any fun facts about yourself?
Well, I'm a 30-year critical care nurse, hearts and ICU care. So I've
Wow.
been in nursing for a long time, worked in Indiana, Illinois, and Minnesota. I grew up
Okay.
in Wisconsin in a farm area. So I have a special love for animals. And if I hadn't become a nurse, I would have been trying to become a vet. I love animals as much as I do people. So that's kind of my downtime is I appreciate helping with animals too. So I I've been doing this a long time. I have done, let me see my little list here. I have done actually, I've been with CardioStart for 18 years. We started in 1987, so I've been here for 18 years of that. I've done 38 missions to 13 countries. So when I'm not
Wow.
doing missions, I am running the charity, which is a full-time job.
Wow, thank you definitely for doing that. Now, speaking of your organization, how did you get started with them? And then also, too, can you tell us what's the name of your organization?
The name of my organization is CardioStart International. Um, and I got involved, I guess it was, boy, in the early 90s. I went on a cruise and one of my first times out of the country, and I went to Jamaica. I got off the ship in Jamaica and I just saw the poverty and the children trying to sell shells and just to try and make a living. And I it really touched my heart. I felt like I'm never gonna go to a place like this if I can't help again. So
Mm.
I got back on the ship and I just made a declaration at that point that I had to help. And so to pay back with my nursing degree, that's what I've been doing ever since, is trying to help out those that can't help themselves. They don't have any opportunity to help take care of their own hearts and their need for heart surgery.
Okay, now, and I do want to kind of go back a little bit because you mentioned about you've been doing missions at different places. Can you share with us some of your places that you have done your mission trips and what were kind of the main objective or the goals that you were focusing on?
Well, we've gone all around the world, and our focus is adult and pediatric heart surgery,
Okay.
congenital heart surgery, valve surgeries. A lot of these countries are unable or don't have the capability to treat strep throat well, so people develop heart valve disease. And by that happening, what happens is this bacteria destroys the heart valve and they need a replacement. And
Mhm.
it happens as young as people in their 20s. It's really sad. And it leaves them incapable of attending school, caring for their family. So it's this really severe condition that leaves them in dire straits. And many of the countries we go to, including Africa, the Caribbean, South America, um, Asia, need help, and they need help to develop their programs. Initially, we started bringing patients here to have surgery, but we found it was really disruptive of the family unit. You would bring a patient to the States or to London to have their surgery, and their parent would accompany them. And they would see how we live, and it really is disruptive for them to go back to their environment and their culture after seeing how we live and the feelings that accompany that. We felt like, we're only putting a Band-Aid on this. We help one child or one adult. We're not making a big difference for that community. And we knew there was another way to make this work. So that's how CardioStart was born.
Okay. And how long has the organization been operating?
Since 1987.
Okay.
Our founder, Dr. Abin Marath, started the program in London, and he brought it to Tampa, Florida. And that is where our main office has remained. He started the program as a 501c3 nonprofit, working at Tampa General Hospital.
Yeah, and Tampa General is definitely known for all of their great services overall. So kudos for him for following his dream and getting it established. Now, what would you say for CardioStart International is the biggest need that you all have?
Definitely financial. A lot of money goes into running these missions. Our volunteers give a lot. They give of their vacation time, they pay for their own airline tickets, their food and supplies to get to a country, a week to 2 weeks or more off. They take a loss. So the volunteers put a lot. So we want to be able to help at least just pay for their housing while they're there. So hotel costs are a big expense for the missions. So that's a big need. But in addition, just the medications for the patients. Any of the supplies that we can't get donated, we have to purchase. We're lucky to be able to work with some generous donors and companies that help with donations of heart valves and those type of things. But there's always accompanying costs in these surgeries.
Got it. Got it. And now, kind of speaking with that, can you explain to us or share with us how has COVID over the last 18 plus months, how has it affected your company in regards to just the operational standpoint from it, as well as being able to fulfill your missions and do some of the things that you were doing pre-COVID?
Well, COVID has definitely made us try to reassess how we can help from long distance. COVID shut us down from travel, and that has been very difficult. Our doctors and nurses and perfusionists all work in local hospitals, so that they've had to stay in their hospitals. They can't leave the country, and if they do, they would have to be quarantined, which eliminates their ability to work at their local hospital. So that all of that just precluded them from leaving the country. So we could not go to the countries to help with the surgical procedures. Now, what stands apart for us is we go there and teach the locals to do the surgeries. We help their surgeons to increase their ability to do complex surgeries, which most of these patients are very complex because their disease starts early and young and goes on for many years. So we do have to go side by side and work with each of the departments to train them and teach them how to do the heart surgeries. Right now, we've started to do a lot of training like you and I are doing now on Zoom, online. We'll do consultations with their physicians, discussing cases and how they can best go about treating them. We're training nurses online. And I would say one of the biggest difficulties for us overall in the charity is to try and do fundraising. And we are unable to do them in person. And that's, a nonprofit is an interpersonal relationship. And if you can't get together with people, it's difficult to raise funds. So that has probably been the biggest struggle for us, is trying to maintain funds in the climate of COVID.
Yeah. And speaking of being able to receive funds, if someone wanted to provide a donation or give a donation, what would be the process, as well to how could they pretty much connect with you overall if they wanted to reach out?
Well, the best way would be our website. It's www.cardio, CARDIO, start, START.org. And we have a donate page on there where they can directly donate to the company with no overhead amounts coming off that might happen on another platform. So I would recommend doing that.
Okay.
They can also contact me directly. My phone number is 503-926-4232. And I would help them through whatever process works best for them.
Okay, perfect. And I will definitely make sure that I provide all of Janine's contact information in the description, and or to donate, that you will have all of that contact information, because again, we kind of talked about this a little before we started the recording, that those who have wanted to donate in the past may not have been able to over the last year or so, but definitely I'm pretty sure they would be very grateful and appreciative for any amount or any size of donation that you can possibly provide for a great cause. So definitely make sure that you reach out and connect with them and look at their website so you can learn more about the CARDIOSTART International. Anything else you want to just provide with them, Janine, before we end our interview?
Well, I would love to thank the Tampa area for all their support. We have a warehouse down there, and the hospitals and clinics in the area have donated supplies to us as they change over lines or have items that they no longer need. We are very thankful for that. And we send those containers to help countries that are suffering. One of the things we found with COVID was there was a great need locally throughout the United States for gloves and masks and gowns. And we were able to draw from those supplies that we had and give back to our community. So we're very thankful that we were able to do that.
Awesome. That's amazing. Well, thank you again, Janine, for your time. And thank you guys for tuning in with us. And again, don't forget to reach out to Janine and just learn more about CARDIOSTART International. And make sure you share it with your family and friends, because you never know, they may be willing or wanting to connect, or may know someone that may benefit from their services. So again, thank you all, and stay tuned for next time as we connect with Tampa Bay 501c and nonprofits. Thank you, guys. Bye.